Over the last 10 years, I think there really has been a massive transition in facial plastics with respect to volume enhancement. Some of that started with the introduction of the fillers, the Juvederm and Restylane and those things, but I think fat transfer has really taken that concept and taken it to a whole new level.
Yeah, in the old days there was an idea that really the treatment for aging was lifts to pull back on skin, and that is a big part of it. Skin loses elasticity with time. But part of the reason we see that descent, especially around the cheek and mid-face early on, is because we all lose volume. The fat pads we naturally have start to shrink, even the bone shrinks a little, and we lose volume in those areas.
Yeah, for other patients it's always been the way it is. For some people they just tend to always have this hollowing under their eyes. There's that sort of tear trough deformity, and fat transfer has really revolutionized the idea of how do you deal with that sort of depressed, hollowed-eyed look. And I think the technique that we use with fat transfer is really unique and really is allowing us to get patients results that last long term.
We have patients as early as their early 20s who are really coming in complaining of that hollow dark circle under the eye, and how do they deal with that? Sometimes we combine volume transfer with bleaching the skin with a bleaching cream to help with some of the pigmentation. But filling in that hollow depression is really important. And there are some disadvantages to using temporary fillers in that area that I think fat transfer provides a real nice alternative to.
Yeah, so for us, the way we do fat transfer now is way different than we used to even do 7-8 years ago. Traditionally, a lot of surgeons continue to use an approach where they just take a really handheld liposuction cannula, they go through, they remove some of the fat, which they then have to centrifuge and remove the fluid and inject what's left. The problem with that technique is you really get a lot of fibrous connective tissue along with the fat. That's one of the reasons a lot of patients used to be worried about getting that lumpy, bumpy look underneath the eyes. That's really all been done away with now.
We now use a technique called water-assisted liposuction, which is a modality, it's a machine that uses water pressure to actually wash the fat cells away from that surrounding connective tissue. So what you end up with is a nice volume of fat that's pure and injects very smoothly, and it frees up all that fibrousy connective tissue that used to put patients at risk for having lumps or bumps.
Yeah, it's a nice technique because really the important thing with fat transfer is this is a fat transplant idea. So you really want to do everything you can to make sure that that fat cell is viable. Using the water-assisted liposuction allows it for a couple of benefits. One, because it's water assisted, you're not really doing that shearing motion of putting the liposuction cannula back and forth. Once the fat gets pulled out, it's really going through a filter system that removes any little bit of fibrous tissue that's there, and then there's no longer any need for that centrifuge process, which used to also tear apart the fat cells a fair bit.
So this is far less traumatic to the fat cells, and the importance of that, as already been mentioned, is allowing those fat cells to live. What we're doing is taking viable fat cells from somewhere else and injecting them into the hollow areas of the face and expecting those cells that live to get new blood supply and become a permanent part of your facial fat pads.
Yeah, so if you have that sort of drawn out hollow effect going on because of either aging or it's just again a family predisposition issue, if that hollowing teardrop dark circle idea is a problem for you, or just hey, over time things have just sort of lost a little bit of volume, fat transfer is a fantastic new approach for this.